Okay, good morning, everyone, and welcome to the Scrutiny Committee for Adults and Health. Please forgive my glasses. I've got a little eye problem, and I'll be sharing them with reading glasses, but I will see you hopefully. So I'll make sure that I don't miss anyone, okay? So I would like to welcome everyone to this meeting. As you know, my name is Jill Slocum. I'm the chairman of the meeting, and I would like to introduce our new vice chairman, Claire Sully. And I hope that she enjoys the meeting, and welcome, Claire.
Thank you very much.
Thank you. The agenda pack is available. Oh, and I also would like to welcome Edric. Edric, I apologise, I will get it right at some point, but welcome to our committee, and I hope you enjoy it. Thank you very much. The agenda pack with papers is available via ModGov or directly from the council's website from the link which was sent out to members. Please can I request that committee members who are attending online keep their cameras on for the meeting. Just be good to know that you're there. I am requesting other members and officers turn off all microphones and videos, but please remember to turn on microphones and videos when you speak. This helps the background noise, call quality, and anything disrupting the meeting. When I invite somebody to speak, could I clearly state who you are for the benefit of everybody who is listening to the meeting so they can identify who is speaking? Can I remind all committee members to use the chat function solely for business, of course, otherwise it's distracting. And I also welcome to any other members of the public who might be and media that are joining the meeting. As agendas are now viewed electronically, could I request that members and officers refer to page numbers from the published agenda pack to assist all present in finding the appropriate information. So item 1 on the agenda is apologies for absence.
Thank you. So we've had apologies from Councillor Govier, Councillor Ben Ferguson, Robin.
Oh, I beg your pardon, it's me. Sorry.
And Councillor Christine Lawrence. Thank you.
Thank you. Sorry about that. Item 2 is minutes of the previous meeting, pages 9 to 14. Are you all in agreement to approve the minutes, please? Oh,
Chair, thank you. Can I just say that my name is not included as an apology on the minutes, which I passed on to the vice chair. Thank you.
thank you. We'll add those onto the minutes, and sorry about that. Thank you very much. Item 3 is declarations of interest. This is where I invite members to declare an interest they're aware of, but personal interest as members of district, town and council or parish is available for inspection on the website. Do we have any interest? No. Thank you very much. Item 4 is public question time. I believe we have no members of the public here today. No, ask questions. Okay. Item 5 is the work programme. This is on pages 15 to 22. Do we have any comments about the work programme? Anyone want to comment on the work programme? You've seen it before you. I think obviously it's a moving feast, so we can add things when we feel some things will come up nationally, and obviously there's some things that people may ask to come to this committee. Claire.
Thank you, Chair. I was just wondering about the dentistry. Other members have mentioned it to me. It is included in the, to come into the work programme, but it looks like we haven't had a response. Is that correct? So could I just ask for an update on the dentistry elements of our work plan and where we are, if possible? If that information can't be obtained today, I'm happy to wait for an email.
Sure.
Okay, we'll look into that. We have had the dentistry, as you know, and I looked on the programme before to see some of the responses come back, but I think it's a good one that we need to keep on top of, that one. Thank you very much for that. Anyone else has got anything they would like? Everybody happy? Good. And we can, like I said, we can bring this up at each meeting, and we can make sure that anything pertinent that you feel you want to go on the agenda, something that you feel is everything's worth looking at, of course it is, but we'd be more than happy to do that. Oh, Councillor Probston.
Would it be possible to have, there may have been a briefing before, kind of, a little bit more of an in-depth briefing on what the process is, sorry Mel, from the point at which somebody is noticed as being reported to the council for potential care, whether it be domiciliary care or care going into a home, moving along a path of usual ill health. And how that actually happens, what teams and where. We have had it before in bits and pieces, but there are quite a few people now that have come via me and said, why isn't this working? So I'd quite like to know a sort of a more definitive answer as to what that process is. And I know that each case is slightly different, but which particular entity does what and when, and where it can sort of fall apart. Or, you know, we've had hospital, the idea of having a team within the two hospitals doing assessments in that situation. I've had reports of no, nothing happened at hospital. And so, you know, just a little bit more specific briefing as to how it actually works or may not work on occasion. Thanks.
Mel, do you want to, you can probably give a much more precise answer to that than me.
I can, but this doesn't seem to be. It's got this, is it? Okay, lovely. Okay, so yes, of course I can. What we can do is we can bring you a sort of pathway map, which is probably the easiest thing to do, which actually a little diagram which says this is points of contact to us, this is where we go, and this is how we take that forward, so we can sort that out for you, no problem at all.
Thank you very much.
We could probably do you, rather than, what we could do is in between, and I'm looking at John, because I'm sure between John and ourselves, we can sort that out for you, and we can send it to you out in between. And then if you want to ask some questions or want any more depth, we can do that. So we can give you a quick brief rather than waiting for.
That would be, yeah, absolutely, because it is something that, you know, maybe a briefing or send that, and then if there are quite a few questions, maybe a briefing at some point to see if we can get a greater understanding, so that when we are actually communicating as councillors with people on this subject, we're not kind of left not knowing quite where to aim any queries. Thank you.
Can I just say something?
Yes, of course.
So just to say, also, as Matt has already said, but you know, people approach our service in lots of different ways. It's not just one way. So they may be in hospital, they may be in a care home, they may be in the community. And I think our approach is very flexible with the people that we get and the people who want to approach us. But the Care Act assessment has always been the thing that I think members have thought was, you know, the hold up. But, you know, we do triage people very carefully and go back to them and say, look, I'm sorry, you're further down the queue now, whatever, because you have to put the most urgent people first. We are getting those numbers down as well, and that's a really big task, but they are coming down. And we reported on that last time. So I'm glad you want to know. I wish all members would get themselves tooled up to know the route so that they can actually help residents when they ask the question. So it's a good question, and thank you for it.
Thank you. It's one of the areas that I brought up as well several times. So I think perhaps, Mel, that would be for every member. I think it's an interest that we are trying our hardest to learn about. I have to say, I learned an awful lot from this report today about that. And I think that it will explain itself as this goes on today. There's an awful lot I've learned today that I didn't think was happening. And again, it's happening. So thank you, Mel, for that. Can I go to Councillor Bruce, please?
Thank you. I think that we've got item to be added to the agenda is the CQC presentation of what they do. I'd like that to be a little bit more in depth in terms of how does the CQC affect us as a council, and how, you know, in terms of some of the failings that were picked out with the CQC earlier this year, and whether that creates any risks for us. Thank you.
Could I say that, if I may, that I picked the CQC up in this report about how that we report back and how that they report in. So I think there's a lot in this report that may come out today. So I think let's just leave it now for the moment and see if everyone's clear at the end of this. I think there's a lot in here that will come out on that, but I read it quite extensively about that, so I was quite pleased. So, okay, no other questions? Okay, so we'll move to item 6. No, sorry. Item 6, let me make sure I got this right. Item 6, budget monitoring report, and hand over to Mel Locke. Thank you very much, Mel.
Okay, so we're going to run through the budget monitoring here today, and you've got me doing it rather than our finance team, which is absolutely fine. So, if you can move on to the next slide, please. So what you'll see, which is unusual for us, or has been in the past, is that we are underspending this year, and our current underspend is 2.1 million. What you'll see if you look at the detail of the report is that we are underspent on our residential and nursing beds for over 65s and slightly over on our home care. That's absolutely where we want to be, because what we're desperately trying to do is keep people, as people want to, at home as long as possible and not place in residential and nursing as often as possible, so that if we're placing in residential and nursing, it's for a shorter period and we're keeping people at home as long as possible. So overall, the budget is still underspending, which is good. The other underspending here and the favourable is on our learning disability services. All of this we'll talk about a little bit later on when we talk about the work that we've been doing in our transformation. But what this starts to show you is how our transformation plan is working, because it's doing the things that we expected it to do. So overall, our budget is coming under, which is great. The area of overspend that you may have looked at is on intermediate care. And that's around how we are working with our acute hospitals and our communities to ensure people are as independent as possible when they come out of hospital. We are expecting that to slowly come down this year as we continue to use less beds in that service and close some of the beds that we have, and again use more people go straight home from hospital. So an overspend at the moment, but overall, if I look at the bottom line, which is what I always look at, is we are underspending on that budget. If we move on to the next slide, which is our medium-term financial plan, what we also said this year is we would make savings. And within that, again, you can see that we have either achieved those savings or we're on track to achieve them. So there's nothing in this space that we said that we would put here to deliver that we're not able to deliver this year. We've either delivered it or it's on track for delivery. And again, that's part of the transformation programme that we had in place, plus some changes in the way that we are commissioning services for the future. I'll stop at that point and see if there's any questions anybody has.
I just wanted to raise, if I may, that I'm really pleased. And Mel, you know what makes me, warms my heart is about home care. And I picked this up in this report all the way along, and we'll hear a lot more about that. But it's a good, I'm glad that we seem to be saying those words out in the open more, that we didn't appear to be before. So I'm very, very pleased. So thank you for that. Does anybody have any questions? Okay.
Can I ask Councillor Wakefield about the underspend, to give us a bit more context?
Can you put the mic down to you?
Sorry.
Can't hear you.
Sorry. Can I ask Councillor Wakefield about the underspend, to give it a bit more context, because you spoke about that in this week's exec, and I felt that was there was good clarity about what the underspend actually means in reality to the service. Thanks.
Can't remember exactly what I said, to be honest, but I certainly said that at this time of the year, it's very good to have an underspend, because we don't know what the winter holds. And we do tend to get more people coming into hospital and coming into care in the winter, and we don't know what's coming ahead. I think it is testament how well, as Matt has already said, some of the measures we've taken are working to keep people at home. And that has been the thrust of the service for such a long time, you know, that is what we want to do. And it's really making a difference to the budget, as well as actually having a real budget at the start of the year. I think probably people will agree that for the first time we had a real budget that actually did reflect what we thought was going to happen during the year. I don't think there's a sudden uptick in health in people in the community at all. I think it's just simply that the numbers that you project sometimes go up and down, and we could well see that the underspend is taken up in the next few months. So I think that's probably more or less what I said, yeah.
Yeah, thank you. You said it doesn't mean we don't need it. Thank you.
Thank you, Travis. I forgot, I'm remiss of me to thank the portfolio holder for being present today to answer all the difficult questions. So thank you very much. Thank you. Councillor Osborne. And welcome. Thank you.
Yes, I'm sorry I'm late, Madam Chairman, but yeah, sort of various bits and pieces, and also trying to find somewhere to park, because you can't, my pass doesn't work for the car park here. But I'm here now, and I do have a question, and I do welcome the current budget monitoring report, the fact that we are at this point showing an underspend, that regarded as it will, and it's a very handy cushion to have going into an unknown winter. However, if we still have an underspend or finish the year with an underspend, will we be allowed to take that into the next financial year? Because we really don't know what the next financial year is going to hold, or how generous or otherwise, what central government may decide it's going to do with adult social care funding going ahead. So if we still have that surplus, I really would like to see it carried forward and that it's there as a cushion, possibly for next year.
Well, what we do each year, as I'm sure you know, is we reset the budget. So we will be resetting this budget, and as part of that reset of the budget, we look at demand for the future. So it's never stable, is it, in terms of what demand's likely to be? So I'm not going to say that we'll keep this and carry this forward, but what we might not need is as much of the new money that we are projecting that we need for the next year. So we know, if you look at the budgets that we last set and what is in our predictions at the moment is, I think there's about a 34 million increase in adult social care need for next year that we're predicting at this moment in time. Now that is really dependent on what the living wage does. So we won't know what the living wage is until probably the 30th, and I'm hoping the 30th will know that. At the moment, we're predicting that will cost us about 6% increase in our budgets going forward, and every percent increase is about 1.5 million on our budget. That's the sort of price and cost that it will deliver for us. So I'm not going to say we're going to keep this, but what we will do is this will help us to not need as much money going forward next year if we can keep to it, and if we can continue to manage within it.
Thank you.
Can I just add something? Councillor Wakefield. Sorry.
Yeah, can I just add also, I'm reading a book about the crisis in social care to try and get my head round what we're doing about it. And one of the points it makes very strongly, and I just want to make this point to the committee, is that we have been really successful as a country with our health service in getting people to live longer. Now, I know there are some suggestions that that might not go on with the next generation and the way they're living, but we have been successful in getting people to live longer, and I hope to live well for longer. That means you need to do something about adult social care, which no government has addressed properly. And, you know, you can't just expect to have people living longer without the need for more care. So I would just put a plea in public that we need to get this sorted. The health service, for all its issues and faults and problems, has actually done a fantastic job in getting people back together out of hospital and feeling well for longer. But it's not going to work if we don't look after our elderly, and that is our big problem at the moment. Thank you.
Thank you very much. Can I have Councillor Stanton, please?
Thank you, Madam Chairman. And good that you mentioned the increase in caring for people at home. I remember that was getting going when I first got involved in adult social care in the middle of 2022. I wanted to raise a question about discharge from hospital, but would that be better done under the performance report? Yeah, okay, I'll hold that till then. But just generally, 2 years on from first seeing all this stuff, the progress on budgets and finances and coping in an impossible situation, as Councillor Wakefield has said, is quite impressive. But in the end, the solution is for the government to fund social care properly.
If no other committee members, I'd now like to call on Councillor Mandy Chilcott, who's online, please.
Thank you, Chair, and great to see you there and chairing today. First question is around the medium-term financial plan and the tracking of those savings amounts. And when I look at the programme that we're going to talk about, My Life, My Future, there are several there that seem to clash with what you're trying to do within the programme. And if I just pick up one by way of an example, so we've got the Learning Disability Supporting Employment Service. That is something that the programme seems to do, yet you've taken money out of it here and yet are delivering more. Can you just talk through how that alchemy has worked, please? That's my first question.
So what we've done in that space is understand who else should be providing the funding for this type of support. So we have funded for a considerable amount of time our Discovery to deliver that for us. What we've looked at now is what government funding has come in via other areas for employment. So we're working with our employment agencies out there to deliver differently. We've also looked at changing the way in which that service runs and how it works with Job Centre Pluses, etc., etc. So we've been able to continue to deliver that service whilst looking at alternative funding streams rather than the council having to do that. So we are still funding a small amount to it, but not the amount that we want. So the outcomes we're achieving are as good, if not slightly better, because we've linked into other services that have had additional funding to be able to deliver that.
Thank you for that. And I see that's sort of one of the successes quoted on another slide we've got before us today. Yeah, what it's actually meant is we are getting partners to do some of that and take some of that responsibility for delivery. So it's only working with partners, and it's just acknowledging that those savings have been made. The other one there is the floating dementia, and the slide's gone from in front of me, so I can't remember the exact words, apologies. So it's a floating dementia support, and I'm just very understanding that the numbers of our residents with dementia are rising due to that longevity of life, and I'm just wondering whether withdrawing that line has had any impact. What I'm trying to get to is whether any of these savings have actually in any way had a negative impact elsewhere.
So obviously it's about how do you deliver, isn't it? And how do we deliver that support? And actually the organisation that was delivering that for us felt that the service that they were doing wasn't probably the right service. So what we've done is stop that contract and work with other agencies to see how we can deliver better. So what are the Alzheimer's Society doing? What funding have they got that they can support us with? And just change our way in which we're working. It's about how do you commission differently, and how do we use partners to help us? When should it be us? When should it be partners? And again, we're using other partners to support it in this space. So yes, it will have an impact, but not the impact we expected it to have. Every cut that we make has got an impact, and we have to make the right things to make the cuts appropriate so that we can survive as a local authority. And it's about how do we work with our partners to be able to deliver that. So that's what we're trying to do in that space. The other thing that's happened is our health colleagues have enhanced their IDDS, which is the intensive dementia service that they have, which wraps around people. And interestingly, I was just up with the team about 10 minutes ago or half an hour ago, and a call had come in there about a couple that were really struggling with their dementia, and the IDDS service were already in, and we were going in to enhance that later on today. So you can see by using other things and the specialism where people are really complex, and perhaps climbing out of windows and being supported in a different way, we've got a mix of services that are working together to deliver differently.
Thank you very much. And I suppose my question within all of this is we have employed Newton at a huge amount to the public purse, and I guess it's, you know, how much of this could have been done previously, but I'll leave part of that there. My last question really is around, we've talked a lot about governments not paying, being short of money, but the dialogue really needs to be around prevention countrywide, whether that's NHS, whether that's adults, and that seems to be lost in translation. And for me, the key really moving forward has got to be that prevention agenda as opposed to just money. I think the two go hand in hand, and it's really important that we keep that. I know I do a lot with the NHS, and certainly that's absolutely on their agenda as well. So it's not about money, it's about how that's spent, and also trying to get to that point where it's before the need arises. I'll leave it there, Chair. Thank you.
Yeah, I've just thank you very much, Mandy. Thank you very much for those pertinent questions. I need first of all to go to Rosemary Woods, and then I will come to Councillor Wakefield, because Rosemary Woods was ignored the first time. Apologies, Rosemary.
Thank you for that, Jill. Yeah, I might be on the wrong point in the agenda because I got into a tremendous muddle with this because we have the budget coming separately. But I put on my notes that I was worried about the redundancy plan that's going forward in the county. Will that impact on any of our services?
I think this is going to come up on My Life, My Future.
I think that might have been where I got it.
So I think we need to keep focused on the budget first. It is pertinent to it, but I think when we go through on My Life, My Future, there'll be lots of questions that come up, and I'm going to ask Mel how the best way to handle that first. Can I go to Councillor Wakefield, please?
Yeah, I just wanted to reassure councillor Chilcott that, you know, the prevention agenda is the big thing that we're working on. And we're certainly working on it with the health service. At the Health and Wellbeing Conference we had recently, we were talking about prevention a lot there with our health colleague, our NHS colleagues. We're talking about housing, and that is now something that is within my and Mel's portfolio about how we build the houses to keep people healthy for longer and where they can stay for longer, as well as designing them for the sort of population we're going to have going forward. And I think, you know, don't get this wrong. We all know about prevention. It is really important, and in fact, it's the only way to save our services is to get the prevention right, so less people need to use them. And I just want to also comment that when we talked about savings last year, and all departments in this council had to make savings, the ones that came from adult social care all said, we will make this saving, but we will try and deal with this problem another way, using partnerships, using other money that we can lever into the council. And that's what's been done, and it's very successfully done. So I'm very pleased to say that I don't think, as so far, our services are failing as a result of having taken some money out, and as Mel has said, using it elsewhere. But partnership working is the way forward, making sure that we get the best out of the NHS money that is available and use it within our society in Somerset. And because we have the same area as the NHS now, we are actually the same council area for the NHS as well. That gives us a huge advantage in getting that to work. So thank you.
Thank you, and I think it's something we all hope for. I think it's good that people express that concern though, because any savings does make you think about services. So I think it's really good that all members keep this on the agenda. Can I go to Councillor Lawrence, please?
Thank you. I just wanted to underline what was just been said, really, the prevention agenda and the future, and how much the need will increase as we live longer continually, which is fantastic. And do we have a clear plan? What does 5 years look like from now, and what will our expenses look like for the future, so that we're all travelling in the same direction? It doesn't come as a shock to us when we realise that more people needing more help. Thank you.
Do you wish to comment? I think that's a very good statement you've made there, and I think we can.
Just to say, I think we do know that, but I think we're already into that. We've already got people living into their 80s and 90s and hundreds. I don't think they're going to go much beyond that. In fact, as unfortunately, the projection is that society isn't going to live, or people are not going to live quite as long, because they're not living the right sort of life and not getting the right sort of food, and they're not getting enough exercise. And so I don't think the projection is that it's going to suddenly shoot up. At the moment, our main concern and spend is with people 80 and over, because they're the people who need more support. But we're keeping people fitter for longer and at home for longer in their 60s and 70s, particularly.
Thank you. Can I go to Councillor Lasham now, please? Thank you.
Thank you, Chair. And I'm at home in my 60s, getting close to my 70s, so I'll do my best. Thank you. Chair, may I, through you, ask Mel to talk us through the bottom line of the savings spreadsheet? So to support people to live independent lives, there's 5 million, 3.9 million and 5 million, and I don't understand how those figures work together. I do realise that, but it would be really helpful for Mel to talk us through that line, please.
Thank you.
Hang on. Give me a second. I'm on the next presentation. That's not good, is it? Let me move back to that presentation. Hang on, give us a second.
I did the same thing, so that goes.
Where are you looking? Just help me out. Are you looking in the bottom? I think you're looking in the savings, aren't you?
Yeah, the savings and the tracking of the savings.
So you're looking at the maximised fees across adult social care, the 3.4 million.
The line below that, please, Chair. The supporting people to live independent lives. So the other lines add up. That line adds up to more than the saving amount.
Yeah, it does. And that's because we'll overachieve. That's why you're seeing that, because we're already seeing some more overachievement in that space. So it doesn't add up in the way that I did that yesterday and looked at it and thought, why isn't it adding up? The other challenge we've got is the maximising fees across adult social care, although in my budget is a finance piece of work that's happening, and that's around our fees and charging.
Okay. Right.
But
Thank
when we
you.
talk about support people to live independently, that is the work that we've asked Newton, that we've been working with Newton to achieve. So that is your 5 million in this year. There was 5 million in last year, if you remember, and that's the differentiation here. But we've already, so it's over a 2-year period, and it's already come out of the budget. So my budget position that we've got here, that has already come out of that position.
Okay, so it's how those savings have been profiled over the 2 years.
That's what the difference is.
Yeah. Okay. Thank you very much, Chair.
Thank you very much for bringing that to our attention. That's very good. So spot on as always. Okay, with no other further questions, I think we've definitely given Mel a good go in there. And now we're doing it again. Item 7, My Life, My Future. This is Mel and Paul Coles. I think he's assisting.
No, it's just me.
Oh, sorry, beg your pardon. Sorry, just Mel. Apologies. I wrote that down as well. That's so ridiculous. Mel, I want to ask you, we probably all of us got questions through this report. Do you want us to wait till the end, or do you want us to on the way? How do you want us to play this?
You can do it on the way if you want, or you can wait to the end. I have no problems. It's not going to, I'm not going to take long to do the presentation. So you may want to just let me run through the presentation pretty quickly and then give me the questions at the end of that.
Thank you. We'll do that then. That's very kind. Thank you.
Okay, so you will know, I just want to highlight to you. So if you want to go to the next page, please. Great, thank you. I just wanted to reiterate to you the My Life, My Future transformation programme. This is part of the work that Newton have been doing with us. And one of the reasons we're bringing it here for really to explain to you that Newton are slowly, and will probably have left us by Christmas at the latest. But they are slowly leaving with us at this moment in time. And what I wanted to be able to describe to you today is where we've got to so far and the work that we're doing to take this over and continue to run it. Because what happens when any organisation comes into support, they've come into support, they've taught us what to do, and now it's about how do you then ensure that's business as usual. And that's the purpose of the report today, is really starting to say that piece of work that Newton done is closing. It doesn't mean to say our transformation has stopped, and we're continuing to sustain that at this moment in time. So just so you know, the transformation programme was really about building on the strengths that we already had in Somerset, but actually giving us a clear plan for that improvement. And we needed somebody to come in external to do that, to add capacity. So we could have done this ourselves, but actually it would have probably taken us 6 years to get to a position we're in a year and a half. And the world changes in that 6 years. So actually bringing the additional capacity in and actually some of that experience has really helped us and helped our frontline staff, which is also really important. So the programme now is at that sustainability phase. That's what it's there for. We're on that change and adopt and embed and build that into our business as usual. And we've got some really key ways in which we're doing that, monitoring that and taking that forward. So if you want to move us on to the next slide, please. So what's the benefit been? Well, the benefit has been that it's all been about increasing independence wherever possible. And one of the big focuses of this that I'll describe a bit later on to you is, as we'll take this on to you, okay, we'll take this on is around us also working with people that are working age, so people with a learning disability. So if you look at our budget, and we always talk about older people, but nearly half of our budget spend is on people with a learning disability. So this really is about looking at everybody who we support and ensuring that they can have the best life they have as independent as possible. But for people with a learning disability, that progressive model of delivery. So how do we help people to progress, whether that be into employment, whether that be less hours, whether that be to manage their behaviour, whether that be to learn new skills. So again, we've done an awful lot of work in that. So what are the results for us? If you can move on to the next slide, please. So the full transformation activity of My Life is on track to deliver our 10 million. We're there. We know we're delivering it, our benefits are working, and we're seeing where we are. We also know that there is additional savings in for next year, which you will see as part of the MTFS coming forward. You'll see that actually additional savings on here. So yes, it may have cost us 7 million Bearing in mind our ICB paid 2.5 million towards that, but it did cost us to deliver this programme of change. But it is a minimum of a 10 million year-on-year savings that you will see, plus additional. So I think we will get to our stretch target in the 3 years, but at the moment we're seeing 10 million this year and another X amount, which I'm not going to give yet until I've absolutely nailed it for the following year. So if you move on to the next stage and look at what we've achieved so far, I think this is really important. So we're now supporting people to become more independent, so 25% faster through our reablement service. And you may say, why is that important? Why are we trying to get more people through reablement? Well, the more people we can get through reablement means that people are then living in their own homes longer without the support that we would normally do. We're not just looking at the speed in which people go through, but we're also looking at the quality of that reablement service. So how are we understanding not the more people going through, but actually how are we working through that they have less hours at the end of that process? And we know that about 8 to 9 hours less per week per person is coming because we're reabling people far better than we were doing in the past. So not only more people going through, but we're also seeing the outcome for people being a lot better. We're also looking at 40 additional people per month accessing that service. So again, faster, 40 more people, again, that's working. And that's not just people within our hospital, because there's 2 areas to reablement. There's how do you prevent people going into hospital and reabling them, but also how do you support people to come out of hospital? So that's 2 ends of that spectrum. We've talked quite a bit about the average wait for Care Act assessments, and we've tried to work on that by getting our productivity up, by doing things differently. And again, you'll start to see there's been a 16-day decrease in the length of time it's taken to do Care Act assessments. We've also increased the visibility within the team, so 38% more Care Act assessments are being completed. And again, that's a huge amount of Care Act assessments being completed, which is starting to eat into the backlog that we've got. And again, the data that you'll share with us later is how that is reducing. And I know the question you'll ask is why is that in one area, but we'll do that as part of that process, not particularly here. We also know that we're supporting people to move into more independence in their own homes. So 130 more people per year are now staying at home longer rather than being admitted to care homes. And again, that's about how do you promote independence? How do we commission the right services externally or use our voluntary and third sector to be able to deliver differently so people have healthier lives? And we're doing that with help. None of this can be done on our own, and none of this can be done in isolation in adult social care. It's about how we use the rest of the council and the places people live as well to do that. But part of this programme has helped us. The next piece that we're looking at is that progression model, and that's for people with a learning disability. And it always takes a little bit longer to get this right for people with learning disability. The trend nationally is that the spend on learning disability is rising and rising and rising. What we're seeing already in Somerset is that flatlining, which is great. I can't see it coming down, but we'll see where we get to. But you can start to see that trend going. And we've just done a piece of work with the Council for England, working alongside them to actually have a look at that nationally about what that, and as soon as we get that report back, I will start to share that with everybody. But what we do know is that for ourselves, more than 30 people with learning disability have started to reduce and are on different pathways to develop their skills. And again, get things right for people, the costs come down. One of the areas that we've had to work on and should have worked on earlier is around young people in transition, because you will know that people coming through children's to adults, the cost in children's services is a lot higher than it will be in adult services. So if we get it right and get that pathway right for people, there will always be a cliff edge. Now, we're not going to move a cliff edge because somebody reaches 18 or 25 and the services are very different. But if we can move people earlier, we can prepare parents earlier. And what we're seeing in this space is that young people transitioning from children's to social care are being assessed 2 years earlier on average than they were before. So we're not seeing that 18 and a half, 19 coming into us. We're actually starting to work with them far earlier, which is right for them, which helps them to promote their independence, but also helps the market to understand what we will and will not do and what our expectations are on that market. And then finally, 90% of our adult social care staff agree that the work that they're doing is making a real difference to the residents of Somerset. And that's really important that our staff are feeling by working with us in a programme. And what I would say, Newton have really worked with our staff and have felt part of our teams. And that's been a real difference. They've worked with our frontline staff. And that's the change that we've been able to make through this programme. So what's next? Well, it's about sustaining it, isn't it? And that's always the challenge. It's about sustaining our new ways of working as our dedicated capacity decreases. There are some areas of continuing focus that we have still got some little concerns about that we're working on, and they're particularly in our area of discharge and our system partners working. Because what we got Newton to do is have a look at our pathway 1, our discharge from hospital. What we didn't do as a system, because that wasn't the thing the system wanted to do, was actually understand that culture in the hospitals and change some of that. So there's still work to do on that, and we are managing that. But we will continue to monitor this through our operational finance performance meetings and through our regular governance to continue to make sure that what we've started is embedded and then continues to be business as usual going forward. I'll finish at that point and ask any questions if you like.
Well, Mel, thank you once again. I write loads of questions down when I'm sat at home reading all of this, and then you almost answer most of them. So as you're going across, which is really good news. If anyone doesn't have any questions yet, I have plenty, but I'd rather ask the committee first. Councillor Woods and then Councillor Osborne.
Yeah, thank you for that, Chair. I want to resubmit that question I asked earlier because it was on the main report. I had it down as page 29, but it might have moved. But I'm pleased to see that they're working with our staff and they're comfortable with that. But that begs the question, if they've been working with our staff, is that going to be impacted by any redundancy programme that might come in 48 days or more time? Yeah.
So as a local authority, as you're fully aware, we are right sizing the local authority to support us to be able to, one, live within our budget, but also to think through how do we do things differently. Now, one of the conversations, obviously, as part of that, adult social care has to take it's the biggest part of the budget, therefore we are having to make cuts to our staffing as part of that process. But we'll also have to embrace technology to support us. So one of the things that we're doing at the moment is looking at different ways of using technology to aid us so that our productivity is even better because the systems is enabled us to do that. So we're looking at all sorts of ways. So if I gave you an example of that, it takes an inordinate amount of time to look back at your case notes and then write a court report. It takes forever to do that and it's time consuming. If we can get it right, and we are testing it at the moment by using 2 different systems, actually all that data will come together for us in a hit of a button in about 4 minutes. Well, not even that. And it pulls it all together for you. It will devise the report for you, and then you use the staff member to do the bit that they should be doing, which is saying, actually, what do I feel about this? What is it looking like? How do we take that forward? If we can use technology more and more and more, which is what we will do, it'll help us to use our qualified staff to do the pieces that's important to them, which is the analysis of the data and the recommendations. And I think that's a different way of working. Now, it shouldn't impact on this programme because this will be business as usual. But the reality is, if we take a lot out of we have to be really mindful about how much we take out of our central services that supports us. And I can't sit here and say there'll be no impact. Of course there'll be an impact, but there shouldn't be an impact on how we deliver today. But we're going to have to change the way we deliver and the things that we do. And it's about how good we are about transformation as well as downsizing the authority at the same time.
Yes, thank you. Councillor Osborne.
Thank you. I think my question is probably going to be very similar to Councillor Woods, but I know back in April, after the peer review, we did express sort of concern, or rather that the peer review picked up the relationship or the interlink, which was probably fundamental to the success of the programme, was the corporate support from the core that we received, particularly in terms of things like digital and IT in order to support and underpin the work of the programme. What steps are we taking to ensure that we still have that support, that it isn't sort of lost sight of in terms of the proposed quite profound downsizing of the council, that we don't somewhere along the line slip through the net, because we've got so far with this programme and it's very clear it's delivering some very tangible results, and it's delivering the savings, and it would be a shame if that was to possibly be put at risk by perhaps not necessarily having the resources in place, or resources accidentally being moved elsewhere, which could possibly happen. This is going to be at the overall council a dramatic downsize. We don't exist in a bubble in ASC. We're working outwards. We're working with other partners, and I wouldn't want to see anything compromises, particularly in the sustainable bit, which probably comes with sort of risks as well, that when you pull something back, that you also get the pace right as well, that you don't do it too quickly before you're really ready. So it does also feel its sustainability at this stage, that, you know, there are maybe sort of certain hazards by thinking this is great, this is marvellous, and you maybe pull back too quick before people are perhaps as ready as you felt they were. But on the whole, it's a good set of results, and I welcome and thank you for your response to my full council query. I look forward to seeing the figures, particularly in Area South, come down as those new staff come online, and it would be very helpful if maybe you could come back to us with an update report, particularly on these very important metrics, and whether or not when we do performance reporting, I'm probably jumping ahead slightly, we maybe look at sort of things being broken down per area, so we can highlight. It's very easy to hide things in a global figure, but it can be useful to see if there are issues starting to develop in the area teams.
Okay, we'll look at part of that in the performance, but Mel, would you like to?
So let's take this programme as I can't do the wider council today, but I can do this programme of change because that's what we're here to do.
Yeah.
And what I would, what I would say is we are sustaining new ways of working. So what happens as part of this programme is Newton have got a really good tool around sustainability, around making sure our staff, this is fixed business as usual. And I keep telling them it's gold, silver and bronze, so they've got 3 rings. And what we make sure is that they do not leave us until we're all at silver in all of them. And I've said a couple of them will be at gold at the same time. But the sustainability rings are really clear about, and it's down to individuals that will be taking this on. So how are those individuals embedded? How do they know, and how do we know that they are able to achieve what we need to do to sustain it? Now, although Newton will go, they're not gone and flown away, because one of the things that we do with them is we review. So every 3 months at the beginning, we'll be having a catch-up meeting to say, is this working? Is this not working? And if it isn't working, they'll come back, a person. They'll come back and say, what do you think's happening here? How do we do this? You never really leave forever. And I know if they've been working in Kent now for a long time, and they keep popping back there every 6 months or every year, because they're not an organisation that doesn't want success and that success to continue. They don't charge us for that, by the way. So they do come back and support us, and that's part of what they do. So the sustainability matrix is working really well, and we know the area that we're not quite there in, and that's why they've stayed a little longer. So when they should have left us probably October, September time, but we're not leaving until Christmas, because there's a piece of work that we're still not happy that we're absolutely sustained at. So that's part of the work they do. So within this programme of change, I'm not concerned, because we will deliver that within adults. We've also been able to skill up other parts of the service and other parts of the council on how to do this differently. And that's also been part of what we've done. The downsides of the organisation inevitably will have an impact. But if we don't do it, somebody would come along and do it for us and do this anyway. So we're better off trying to do it ourselves and get it right and understand the impacts of that. And there will be impacts, of course there is, of downsizing in any organisation. But this particular piece of work, there won't be impacts on because we'll have nailed it within our service. And our monitoring and managing of that sits over with John and his team, and they're more than capable of doing that and continuing to do that. And you've done a massive amount of work with Newton to help us and probably to develop your skill set and your team's skill set as part of that process.
Thank you. I think that, thank you for that. I think it's wonderful to hear that Newton is still there and they won't leave us and they won't charge us. That's the best news we've heard today. Because that's never been said before, so that's wonderful. Mel, I have a question now just for you, please, if I may. You very, very well put this in this report, and I was heartened to see that the pathway one, as I've always been going on about discharge from hospitals, how things have gone wrong. And by many councillors have given me their individual issues. So it's not just from me, it's from lots of other people who've experienced this. What I want to ensure is, and I think you've answered this question, that our staff are knowledgeable on what is up for patients. The pathway one, where patients can go, they do have an opportunity to stay at home. What I'm worried about is, and other councillors have said in their areas, they've had evidence that that has not been the case. And what I'm hoping is, and I think I get this from your report, that you are saying that you are giving that information out. Staff will know, because what I want to say is, we want to be able to say to the patients that are leaving hospital, there is opportunity for you to go home first. And I think that's very important. If they can't, of course, they're assessed. But the whole assessment needs to be helped, that staff know this. And I do think some staff have not perhaps been aware of all its implications in certain areas, definitely.
So it's an interesting question you asked me, because it's not just about us in social care, because I can't do it all on our own. And it's about that change of culture within a hospital. So if you're on a ward, it's about describing what that person is, not prescribing the care that that person then needs at the end of the day. So it's a change for them about a description of this is the individual, and then the multi-agency team that sit together doing the prescribing of that. And that prescribing of that means a prescription of pathway one, pathway two, pathway three, whichever is right for that individual. Now that cultural shift doesn't happen overnight and is still not quite there, but we know that that needs to happen. We know we need to just change from a prescription happening in a ward to a prescription happening elsewhere. And that's how do we change that, whether that be our consultants or whether that be our nurses on the ward. We've got to change that, and our hospitals are aware of that. So Peter Lewis, who is the chief exec there, is working really hard to help that cultural shift change ward by ward. But it's not going to happen overnight. However, we're clear about it, we're tracking it, and we're working on it. Because if a consultant tells a person, a patient, their family something, and then we go in and try and tell them something else, that's hard work.
Yes.
So it's about trying to get them to describe, not prescribe. And and we're using that terminology because they understand a prescription, whether that be a medication prescription or a prescription of somebody's care. It's about how do we do that differently. And we're not there yet, but we keep working on it.
Thank you very much. And I think the many members that have asked me that question from their own ward areas, I hope they're heartened by this. We'll obviously keep up with this, and we obviously need to review this and go back over it to make sure and check with you, Mel, that that information is getting out there, so we don't come back with the same question. But thank you for being very concise on that. Can I go to Councillor Stanton?
I just wanted to pursue that question a bit further, because I remember vividly when I was Associate Lead for Adult Social Care going and visiting Musgrove and York District Hospital and meeting the joint teams of the health service and our service working together to try to accelerate and improve getting people out of bed blocking and back home. And it was quite impressive what was being done, particularly across two different organisations. But the question really is there anything that we as a committee or that we as a council or individual councillors could be doing to encourage the NHS side of the equation, encouraging the ICB in some way, or pressuring them to get this done properly. Because I remember vividly talking to one of the consultants in geriatric care, and in a sense, being disappointed with the extent to which a consultant level person was switched on to what had to be done to get people fit. People were still sitting in beds, lying in beds when they should be being got out of bed and made fitter and made ready for getting home. I know you know all this, Mel, but the question is there anything we as a committee or the council as a whole or individual councillors could usefully do to get the ICB shifting properly on culture change? I mean, culture change is very difficult because it's not actually culture change, it's behaviour change. You need lots of individual people changing their habits of a lifetime and keeping on doing it sustainably, as Sue said. So anything useful we could do.
I think the change that we've made is the chief exec from the acute is now leading this programme. And the reason we've pushed for him to be the SRO, so the senior responsible officer, is because I can't influence the whole. I can do our best to influence, but I can't change that behaviour, and that's what we're talking about. So the reason he's picked that up, and the ICB have asked him to take that on, and he's taken that role on for the system, is absolutely for what you've just said. We've also got a joint post just starting with us, again, linked to the hospital, to try and look at that seniority underneath him to give some teeth in that space. So I think that will help us. We can crack this nationally. I think there's nowhere that has cracked this totally. And we had, just earlier on in the week, we had the national team come to talk to us about where we were, how's our no criteria to reside, all of those things that you often get. And I think for the first time, the whole system has recognised that it's not just about getting people out faster, it's about that behavioural change. Now, we've been talking about it for more than 2-3 years, but I think having that link in there now and him taking that role on has helped us diagnose the problems. Once you've diagnosed the problem and they've owned the problem, it's a bit easier. But is there anything you can do? I think keep pushing, keep asking those questions of the ICB and of the acutes.
If I follow up, Madam Chair?
Yes.
I just wonder whether we ought actually, as a committee, to be writing to the Integrated Care Board and to the government to stress this point, from an elected representative point of view. As you said, we hear from fellow councillors and from residents about this problem all of the time. And diagnosis, as Mel's just described, is the first step. But where things often fail is the next step and the third step, actually getting behaviour change starting and then embedding it and then making it habitual. So it just feels to me as if we might just be a tiny bit useful in just adding to the pressure.
I think we could do that. I mean, it's a subject area where I've been contacted so many times on. And I think because everybody knows somebody that's been in the hospital languishing in the bed when they wanted to go home, or they wanted to go this, or they wanted, and this, and I think we're all acutely aware of the cost of that. And it's not only about the patient, but we're also aware of the cost. So I think that would be a really good thing. And I will pass that to Jenny, who is, and talk to Jenny about us getting a letter out to the right ICB, especially to sort of suggest that raise our concerns. I don't think that's a bad thing at all. I don't think. Can I go to Councillor Sully first, please? Thank you.
Thank you, Chair. It's a quick question and a comment, and a sort of my own sort of recommendation really to what I think your report draws out is this bold ambition, and I think because we deep dive into the nitty gritty, that to pull it back to that bold ambition of where this transformation activity, which my life, my future is part of, and how it is supporting the helping. One of our key goals as the Somerset Council for a healthy and caring Somerset. And basically what we're trying to do is improve the lives through social care for our residents. What I'd like to see is that, to see where we're doing that, how we're doing that, some of those examples. I'm not a fan of individual experiences. but it does inform our thinking, and I do have an experience of somebody, a relative, elderly, had a stroke, and how she's been served through social care and how she's living independently now. And I just don't want us to forget that. So that ambition, this is not just about fighting fires. This is actually about delivering an inspirational program that people hopefully will look at in the future. So my sort of recommendation or my ask is the Healthy and Caring Somerset, what you're helping to deliver. I'd love to see more of that, how that looks, what that picture is.
So we have many stories, and we have them regularly. So if you read our, so once a month, Adult Social Care puts out a newsletter, a piece of work, and in that there are lots of really positive stories about people and about how people work and what they work. And we've got videos coming out of our ears, which people have wanted to share with us. So we've got lots of evidence which shows how it works for individuals. We can make sure that that's perhaps a bit more visible than it is at the moment to everybody. We can do that.
Councillor Bruce, thank you for that. Thank you.
Thank you, Chair. It seems like this is going really well, this programme, so I'd just like to congratulate all the staff involved in it. There's good news there. I would like to ask a bit more about feedback from service users. So the reablement service, for example, those improvements that have come along is just from the reduction of delays. I'm hoping there's no service cuts involved in there as well. And I'd just like to know, have you got any specific kind of, I know you do ASC feedback forms. I don't know how general they are. Have you got some specific surveys that are going out to service users to monitor? Because we're monitoring the progress and the results in terms of budget and effectiveness and everything, but can we actually get some feedback to us from the users, please?
We certainly can, and we do monitor outcomes because outcomes are the most important piece to me. And yes, we have got quite a lot of feedback on those outcomes. We're more than happy to share that with you. We've got really good examples. We've got a couple of good clips that people wanted to talk to us about, and we absolutely ask people, how did it go? What could we do differently? What's better? So we also have an audit system. So our audit system, so for example, and I don't do many, but all of our teams audit case records. And part of that case record auditing is also ringing the person up afterwards and their family to say, I've read your cases, I've looked at these parts of them, and I just want to see how it felt for you. So we get them in very different ways. One, we can ask straight away. A form goes out straight away for families to give feedback. People choose to give feedback to us. And then thirdly, through our auditing, we ring people up, probably maybe 6 months after we pick the case up, to actually find out what's it like now, did that work for you? And we've got all of the data on that and stories that we can share and that John holds and our team hold.
Oh, that's really good. So they don't have to go through the complaint system if things have gone wrong. They can actually, is that right? Or is that a different model?
Well, they can go through the complaint system. Of course they can. I'm hoping people don't, but of course they do. And you always hear about the things that go wrong, rather than the things that go right. So it's about celebrating success as well as accepting that we don't get it right every time. And so it's about that mixed balance so that people can go through the complaints process if they choose to do that. But what we try to do is, if you see, we tend to manage an awful lot of inquiries coming in at stage 1, rather than that going over to a stage 2 complaint. And managing the stage 1 complaint is all about having a conversation and a dialogue with that individual. And our teams do that very, very regularly.
Well, I think we've done really well with this. Oh, sorry, I really make this quick if you don't mind. Councillor Wick.
I just wanted to sort of wrap up what people have been saying about coming out of hospital and going home. Because, just to remind everybody, nearly everybody does that actually. Comes out of hospital and goes home. Sometimes with a bit of care and support, sometimes with none. We are trying to, I think, work towards the NHS, not just putting them in another bed somewhere else unless they're getting some support in that bed. And I think, just to say to members, I will always try and escalate a case if it comes to me, and I go through to the team with that case. So don't be afraid to send me things if you really think there's something there to say. If you asked any patient in hospital where would they rather be, they'd say at home. So everybody in hospital wants to go home. Of course they do. But sometimes with very complex cases, we have to set up a bespoke package, and that has to be set up before it's safe for them to go home. So I think we work towards that, but there are some people for whom home isn't necessarily the right place. They want to be there. Maybe the family want them. It just isn't necessarily the right place for them. And that's a difficult conversation to have with somebody. It's a difficult point to get over to the family as well. It does happen in some cases. But just remember, everybody wants to be at home. So they're going to say, I want to be at home because that's what everybody says.
And I quite agree. I think the point what we're raising is some people haven't been given that opportunity. They don't feel that's out there. But we don't know why. And I hope now with what Mel's saying, and I think there is a way that now you're working tighter together. I'm hoping that everything could be a lot better.
Let me just clarify, and I think we need to make sure you're clarified on this. Keeping people at home may cost us a fortune. So therefore, not everybody can stay at home. Let's be honest here. Now, legally, I can't put a cap on, because of course I can't do that, because everybody's an individual. But actually, if the package of care is so much more than actually me using a residential or nursing home, I'm very sorry, but we are going to have to look at that unless the families have the ability to top up. So sometimes what we do is say to families, look, yes, you want to stay at home, but from a local authority point of view, this is the amount of money we can give you. If that person, but to stay at home, it's going to cost this much, you're going to have to fund the rest yourself somehow. And be clear that happens, because we haven't got, as you know, endless amounts of money. So we have to be equitable with everybody. So I can't just say to some person, right, it's going to cost me £3,000 to keep you at home, and somebody else, sorry, you've got to go into it. So we have to be equitable and we have to support that. So there are always times when the cost of keeping somebody at home is so great, we cannot do that. If it's a couple of 20, 30, 40 pounds different, we're not going to worry. But if it's extraordinary amount different, we are. So be aware that conversation does happen and has to happen on a very regular basis.
Maybe if it would be possible, Mel, is there a way that we can have a briefing paper on this so that we're a bit clearer? Because I do think sometimes we're not always, some members have said that the people could pay and weren't given an opportunity. Now, there's going to be good and bad. What I'm saying is it might be good for us to know that inner detail. I know we can find a lot of it online, but I just wondered, is that a possibility or not?
Every case is an individual. I cannot legally give a cap because we can't do that legally, and rightly so. So it's really hard for me to give you a cap, but what we can do is give you I can't even give you an average. What we can do is give you these are the circumstances in which we would consider X, Y, and Z, but that's as good as I can get to.
Would that be helpful to the committee? Would people find that helpful?
I think so,
Yeah, okay, right, I need to go to, all right, I need to go to Councillor Lawrence first, and then I'll come back to you. Councillor Lawrence?
I'm putting my mic on. Yes, thank you. I think as well of what you just said, I think some of this is rural issues and what you can do in a town easily. In rural issues, it's extremely difficult and expensive. And I would like you to put a little bit more thought into how we can improve the situation for some of the rural areas. I know it's extremely difficult, but still, their home's their home. And I think for many people, there aren't the support mechanisms out in a lot of Somerset that there are in the towns.
Thank you for that. I'll now go to Councillor Stanton, please.
Thank you, Madam Chairman. I'm not particularly against, well, I suppose I am against commissioning a further report to come to us. It's extra work for adult social care, and I don't think it.
No, I just meant a little small briefing, that's
I'm
all
going
I
to
meant.
suggest an alternative. I think there's a better way to do it, which is to invite 2 or 3 of Mel's team to come to this committee and talk about what they do and how they do it. And I'd suggest a social worker who works with the NHS in the hospitals on dealing with stopping bed blocking and getting people discharged, and somebody who works on the judgment as to whether somebody should be, what I think most social workers do, should be cared for at home, cared for at home, should be in a care home, and just get a real feel for what the stuff is that they have to deal with day to day. I think that would give us a much better impression than a written report.
Mel, do you think that's a good idea? I'm very conscious of taking members of staff out of their daily job.
If it would help, and I think it probably would help rather than me giving you a report, they could come and do that. If we're here, I'll just grab 2 people from the team upstairs. They're on triage every day. They're here. I just pinch 2 of them. which I do regularly. I'm not today, clearly, but we could do that if that would be more
Well,
helpful.
no, we'll leave you to the pinching. That'll be great. Okay. Can I now go to, and this is the last speaker on this subject. I think we've given it a good airing. So, Councillor Mandy Chilcott, please.
Thank you very much. Just a couple of clear declarations. First of all, I chair the League of Friends of Minehead Hospital, so I'm in and out of the hospital a lot. And also I sit on the local West Somerset Neighbourhood Health Board. And it's just really that reassurance. I know we had the conversation around health earlier, but the Neighbourhood Health Board is everybody within the area, might be third sector, adult social care, health. It's a really cross-board group of people that try and improve the outcomes locally. And just by way of an indication, it's just that assurance. I think that dialogue is within the NHS. That's what I'm seeing. And we've had a couple of days. There was a session on falls. We did a whole day on palliative care in the community. So I think that prevention, doing things in the community is happening within the NHS as well as the council. I find that heartening, and I think that's a real step change, which hopefully is welcomed by everybody. So my questions are, when I look at this, much of what we're seeing is not new. Many of the things we're looking at here, for me, have been in the conversation but for probably 3, 4, 5 years. And I think probably the thing that I lost with this programme, and you can correct me if I'm wrong, is that Newton have allowed the capacity to set up and embed these new systems, and the capacity was not there within the team to do it had they not done it. So that's my first question. Am I right in that thinking, Mel?
I think it's not just capacity. So as a local authority, when one of the reasons that we got Newton in was to add capacity to this local authority, but it was also to add skills. And I think that's the bit that I would say is it's the skill change. They brought a massive amount of experience. They brought a lot of analysts in to actually describe and understand and get better understanding of us. They've also brought new techniques in of how we're working and what we're working on. So yes, they've added capacity. They've brought a massive amount of skills for us and that transfer of skills. And they've helped us to look nationally at what good looks like all over the country, what's worked and what hasn't worked. Now, we could do that ourselves, but it would have taken us years. So bringing somebody in to do that with their skill set, their capacity, has helped us. But it's the skill transfer and a different way of looking at things that has helped us during this process.
Fabulous, thank you, because I think that's probably a little bit of a lost in translation along the way, really. So my next question is, most people may be able to stay at home for a while, but many of those over a period, as their health needs become more complex, will need still perhaps to go into some residential at some point. Not all, but it might be a full, something deteriorates their ability to perhaps live independently. So what I'm trying to gauge from this question is, will there be a sort of tipping point where, yes, you've kept them at home, yes, you've saved money, but inevitably a number of those will still end up in residential care? And also, Mel, thank you for those comments around it's not sometimes nursing care, for example, can be the right place, certainly if the need is around the clock. And I don't want to lose track of that either. So will we get to a point where these savings can't carry on continually? Because a lot of the people we are managing really well to keep at home will still reach that point when they need residential care.
So what we know is about flow, isn't it? Flow in and flow out. So we keep people at home longer, and that means that they go into a residential or nursing placement later on in their life, if that's what they have to do. And we will always need nursing homes in this, but there are different other models as well. So when do you use your extra housing is a classic in this space. When do you use extra care housing? When do you use different models of delivery? So residential care, who knows if that even exists in 5, 10 years time? It probably won't, because we'll have different models of care, but we will have nursing care. But if people are there for a shorter period of time, the flow out of those is quicker, therefore you probably keep the money, but we also, you keep the savings. However, we know there will always be demographic growth in this. So you'll always have to put some demographic growth into the budget because we've got more people living longer, but not necessarily then go more people in nursing care. So if we look at our rates of people going into nursing care, we're about static, aren't we? And you'll see that a bit later. It's in your report. It's not in your report, but we can bring that report next time, which, because we manage it. So we look at the amount of people that die in our services and the new people coming in. And we're roughly about a balance of ins and outs, maybe a few more ins and outs, depending on what time of year you're in, but we are roughly the same. So probably not, if we can keep the length of stay down.
Thank you. Very, very last question. Thank you, Chair, for your indulgence. Is you will have new staff come in and out ultimately. How do you think you're going to be able to keep this great new way of working going and sustain it moving forward? Because we all know many of the team are under pressure, understandably.
That's why it needs sustaining right down to your adult social care practitioner, to your business support, to the people that support you around. And that's why it's a bottom-up approach that Newton have helped us with, not a top-down approach. If you left me trying to do all this, we'd have a problem. But as long as our staff below us are trying to do this for us, then we've got success. And you don't change that many below, and it becomes part of that culture. So I think that's the change.
Thank you for all that they do. I'm sure it's appreciated by many.
Well, I don't think it would go bad up there, Mel, because you do a good job. So, and thank you so much. Like I said, I write all these questions out, come to the committee, and then they're all answered, most of them. So that's really good. Okay, well, thank you very much. The outcomes of that is we were talking about actioning a letter to the ICB, which I think we'll have to discuss and see whether you still want that. And Mel is going to triage and bring and nick people from upstairs to come to the next meeting, okay? Nick may not be the right word, but she's going to ask them very politely if she'll come. And we really appreciate that, and we appreciate that time. And I think that clarity on that subject area will be great for us all and other people out there who may not have it quite right. And when you're scrutinising, that's what we're here for. So super. Okay, now we move on to the Adult Social Care Performance and Assessment Assurance Report. And this is from John Hatfield. John, you've got 20 minutes. Yep. And we don't want to, I'm saying that nicely, but it's a good report. I find it very interesting, and thank you for it, as the previous report was very good as well. So as always, so I leave it over to you. Thank you.
Thank you, Chair. I'll do my best to keep within that time, and I'll focus on the slides that we presented rather than the narrative report. And hopefully we'll see as we go through these that a lot of the slides relate to things that have come up in conversation earlier on. Equally, there are some areas where we've had questions that aren't included in this slide set, and we can look to bring some stats around some of those things to a future committee. So most people will be familiar with a lot of these slides. They're the same ones that we've been bringing quarterly to scrutiny for the last 18 months or so. So we start with the front door, so demand into adult social care. This is through our customer contact centre. Apologies, the slides are slightly small on there, but if I pick out a couple of the key trends. So in terms of the volume of calls coming into our customer contact centre, we've actually seen a month-on-month increase for 5 consecutive months. Relatively small, but it is creeping up. And that meant that for the period April to August, we had an average of 5,375 contacts per month, which is a very slight increase compared to the previous financial year. In spite of that, what we see is that our target of what we call the resolution rate, so the proportion of those calls that are able to be resolved at the first point of contact, so by our customer contact centre, without coming to our triage teams, our target is 60%, and we've consistently achieved that target each month this year of just over 60% of those calls being resolved. So in light of the increase in demand, that's a really good achievement. Okay, and then a hot topic of conversation earlier on. So this is around Care Act assessments, and what it's worth noting here, there are 2 sides to this. Obviously linked to the previous slide, we're seeing more demand coming into the service. That means more Care Act assessments being started. And we also know that we've got a backlog of Care Act assessments that are what we've called pending. We've also touched previously on the increased productivity of our teams, and what we're seeing now, between April and August this year, the teams were completing an average of over 400 care act assessments per month. So that's a huge number of really detailed assessments about individuals that are being completed. And in spite of that, we've still got, I mean, at the point that these figures were called together, it was about 700. I checked the figures this morning, and our pending figure, so that's where there's no allocated worker, is 409. So as Mel talked about, that impact in terms of productivity and actually getting through more work, we're seeing that backlog reduce. 409 is clearly still too many, but it is moving in the right direction. Similarly with reviews, so this next report, one of our key measures is the proportion of overdue reviews that have been overdue for more than 12 months. And this figure is too high at the moment. It's currently at nearly 13.5%. But it's worth saying that when we started measuring this in October 22, that figure was 24.3%. So, and there's always a tension between it's the same teams that are completing care act assessments and completing care act reviews, and keeping on top of both of those bits of work is really tricky. So we know that we've got too many overdue. We know that there are too many over 12 months overdue. But again, it is moving in the right direction. Okay, I'll keep us moving through. So unmet need, and when we talk about unmet need, what we mean is where we've completed a care act assessment, we've identified that somebody requires a package of domiciliary care. Are we able to source that domiciliary care package in a timely manner, basically within about 5 days? The real peak has sort of dropped off the left-hand side of this chart now, but we were at a point where we had over 100 people at any point in time waiting for a domiciliary care package to start. If you look at the far right of the chart, you can see that at the end of August, we had one person that was waiting. And actually between kind of May 23 and August 24, I think the highest figure I'm looking at correctly has been about 4. So that's multifaceted in terms of what's had that impact. It's partly how we work with our providers. It's partly the uplift that we've given our providers. And those things together have meant that actually we're able to manage that better. And it's worth saying as well, because of the focus on reducing reliance on placements in residential and nursing care, we're actually sourcing more domiciliary care. And in spite of that, we're still able to source it in a timely way. So another real positive there. Another positive, so this is looking at our provider quality. So for all of the CQC, the Care Quality Commission registered providers in Somerset, we look at the proportion of those that are rated either good or outstanding. And at the end of August, that figure stood at 83%. So 83% of those providers in Somerset were good or outstanding. That's just above the national average, which is 82.4%. So a positive. And also at the end of August, we had no CQC registered providers in Somerset that were inadequate. Keeping with that theme of domiciliary care, so handback, so where a provider tells us that they're unable to continue to provide a domiciliary care service to an individual, we've seen a significant reduction in this. So the monthly average so far this year has been 9 per month. So nine individual service users per month being handed back to us for us to have to find that care elsewhere. Last year, that figure was 13 per month. The year before that, it was 19.5 a month. So again, that's partly to do with our relationships with providers, but a significant improvement in that area as well. And obviously each of those packages that comes back, not only is it upheaval for the person because they're having a different provider, a different person coming into their house, it's actually another package that our teams need to go out to the market to source. So the lower that figure can be, obviously the better. Again, there's been a lot of talk around hospital flow, discharge from hospital, getting people home, and what this visual shows is this is for August this year is what proportion of people, and we look at people aged 65 and over, what proportion of those people following a hospital stay were able to go home. And the figure that were able to go home, including those with an element of support, was 92.5%. So picking up what Councillor Wakeford said, the vast majority of people do get home from hospital. And of those, 82.2% of people actually went home with no formal support. So again, that's a positive. Another one that we talked about earlier, stakeholder feedback. Now, I've made an action to follow up on the specific question around reablement, because we do capture feedback in a slightly different way for people that have been discharged into a reablement setting. This is more general feedback from service users in relation to adult social care as a whole. For the 12 months to August 2024, just under 80% of the feedback responses we received said that the service was either good or excellent. And you can see the last month on there, August, the figure was nearly 100%. It's not all positive. We do get some where, you know, it's a complaint or something hasn't gone to plan. We've had some months, as you can see on the chart, where it's not been as positive, but certainly the last few months that feedback has been positive. And as Mel said, we have a monthly, we call it a highlight report, where we share some of that feedback, some of the really positive stories, but we also look at the things that didn't go right when we resolve those complaints or concerns, and learn from those as well. And then I think the final couple of slides are around our what we call practice quality audits. And again, this is something that Mel mentioned earlier. So we've looked at the Care Act assessments that we completed, productivity is increasing, but another important angle is that we look at the quality of that work as well. And what this shows is that through our practice quality audit framework that ran from September to June, and we just relaunched a new one, we actually completed 1,146 audits of pieces of work, and they're kind of themed. So it was sometimes around case recording, it's sometimes around assessment, sometimes around decision making. You can see them all listed there. So we've looked at over 1,100 pieces of work and kind of peer challenged those pieces of work. It's sometimes the person looking at it themselves and being sort of self-critical, sometimes a peer or colleague. Sometimes, if you're really lucky, the director might look at your piece of work, or one of the service directors. And then I don't expect to read all this, it's very, but what this shows is if it's green, the service standards that we were expecting were evidenced in a very high proportion of cases. If it's amber or orange, it wasn't quite so positive. And the intention of this slide really is that you can see that the vast majority of that is green. So not only are we completing quite a large number of those audits, actually what we're finding and the quality of that work is generally very positive. I'll pause there for any questions.
Thank you very much. I would say, John, it's a very interesting report. And again, I had some questions and you've sort of asked, but I just want to ask one thing. The local authority currently waits notification of the CQC Commission assessment and its delivery under Part 1 of the Care Act, and you're waiting for that. And is that likely to be long? Is that something that's coming up now? Is it? Sorry.
It's really interesting. So we don't know when it's going to be. I keep telling them to come quickly, please, because I'm not very good at patiently waiting. So they've already been to so across the southwest. They've completed it in Gloucester. I think they're coming on their way down. They've completed it Gloucestershire, South Gloss, Bristol. They're due to come to, but they're waiting a date. Wiltshire they've done. Baines they've done. North Somerset they're doing at Christmas. So I'm hoping we're going to be next to get the notification, but I can't say when. We just don't know. But we are already ready. So what happens is you get a notification, and then you have 9 weeks, 11 weeks. There we go. I mean, you tell me properly. 11 weeks to normally get everything prepped in 3 weeks, and then give that information back, and then 11 weeks later they turn up. So we're ready for it. John's team are poised to give all the information. We keep re-looking at our self-assessment. We're there, but I don't know when they'll come. No idea.
I wasn't trying to catch up. John, can you stop the presenting now? Would that be okay?
Yeah.
Thank you so much. The other question I wanted to ask before I go to somebody, so I'm just going to ask this, that I was really interested, and you know what, forgive me, about the staff surveys on this report. You know what, you forget that we're all adults and we're all social care and we're all under this umbrella, but you actually, the poor staff, and these surveys have done, it seems to have done very well. Can you just comment on that, please?
Yeah, so this was in response to a council-wide staff survey, quite a high-level one. It was only a handful of questions, just in terms of a sort of temperature check of staff morale. And there's a bit of analysis in the narrative report in terms of how adult social care responses compared to the council-wide averages. We were above average for the council, where being above was a good thing in all but 2 of the questions. And there were some real positives in terms of, I think one of them in particular was around staff feeling proud to work for adult social care. So some real positives there. And I think the plan is corporately that there will be a follow-up staff survey, I think in the spring. And again, we can bring that back to scrutiny.
Yeah, and I did notice that you said there's a PDF file that you can look and you can see some of the comments that were made, and I think that's really very good. So thank you for that. Thank you very much. A very good report. I thought it was very detailed. And as I say, I had numerous questions, but you were once again able to answer them on the way, which is good. So can I now go to Councillor Stanton first, please?
Hello, Madam Chairman. I'm just referring to page 39 and page 41. So 39 is about unmet need, and you see there's a big improvement from middle of 2022. I remember the fee increase happening, and obviously the pod approach has helped. But then you look at 41, and again there's a big improvement since the middle of 2022. I just wondered whether there was a bit of post-COVID effect in that, Mel, or
It's a couple of things. Yes, we funded the market differently. Yes, we re-delivered, but international recruitment also came in, and you can see all of those things that have happened that have helped reduce. We have oversupply currently in Somerset. Not every county has oversupply, but we have oversupply, and there's plenty of it out there. I think that also has changed the effect for self-funders, so they can get care to stay at home, which is another real bonus for them, but it's helped with the self-funder market and our market. So there's the 3 areas I think that have done it, putting the price up to something that is sensible, but they can pay people properly if people want to come in. I think the other thing is we're seeing people coming into this role. If we can get the career pathway right, we'll see more coming in. That's the next piece to really challenge ourselves on.
Thank you very much. Can I go now to, I've got people online, and I'd like to go to Councillor Bruce. I believe you had your hand up.
Thank you, Chair. I'm going back to my earlier comment, I'm afraid, about the CQC. You've got a slide in this report about the inspection outcomes. Do we have any information about how old those inspections are, whether they're still valid? Do they go back 10 years or more? So this is kind of my point, is I think we are slightly at risk because of the failings that were pointed out with the CQC. I'd like to know how much that applies to us and our providers. And perhaps in the reports, we need to start including some information about how valid or recent those inspections are, please.
Yeah, it's not in the report, but that's definitely something we can pull out and summarise. So how recent were those? I mean, we've only got about 350 registered providers, so it won't take a lot of work to say, actually, this many were in the last 12 months, this many in the last 2 years, 3 years, etc. But yeah, we can definitely pull that together.
Thank you.
Thank you very much.
Alongside that, so we know the care quality inspection haven't necessarily gone back to those that require improvement quick enough. So what they asked us to do, or what we have done, is send a list of providers that we think, please come and see quite quickly and prioritise. So we've sent a list of about 10 to 12 providers out there that we know aren't requires improvement anymore. And we think, because if we go in and do quality audits, think are actually good now. And it's really difficult for those providers, isn't it, if they're not coming, because nobody wants to go. So if we've got that many people that are already good or excellent, where would you go? You'd use the ones that are good or excellent, and that. So we have done that. We haven't had any good results from that yet, but we are still pushing. But we do work with those that are requires improvement. But we've got that data, so we can just pull it out for you and share it.
Please keep pushing. Thank you.
Thank you very much. Thank you. Very good question. Thank you. Councillor Woods, and then I'm going to go to Councillor Chilcott.
Oh, I beg your pardon.
And that's the wrong way round. I'm going to go to Councillor Woods, then Councillor Osborne, and then Mandy Chilcott, Councillor Mandy Chilcott.
Yeah, Councillor Woods is here. Do you have any record of where I was very much against international recruitment because I felt we ought to be providing our own care from our own people, but it has brought in a lot of very good people into this country, and I wondered, do we make best use of them? Because I've had people that I know who are very much more qualified than the jobs they are actually doing. Do we actually monitor that we've got the right people in the right places?
No, of course we don't, because that's not what we're here to do. If people come to the country to do the roles that they choose to come to, and they are managed by the organisation that has the licence for them to deliver. However, we do have quite a few international recruits in our social work, and obviously we work with them really closely, but they're social workers, they've come to be a social worker, and therefore we help them to continue to grow their career in Somerset. So yes, we'll grow and ensure that they are as good as they can be and that their leadership skills are there, but no, we wouldn't do that in the market. People come to do the job that they come to do. Now, they may choose to do other things after that, but that's not about me and how we support.
Just quickly, can I just say that the more of a risk to us is that they go to the NHS who pay them more. That's much more of a risk to our care. That's what they do, because the NHS will pay a bit more than we can pay.
Yeah.
And that's a bit of a risk.
Just a point, my deputy wants to make a point, please.
Yeah, I just want to note really the committee, I feel uncomfortable when we talk about our own people and things like that. It starts to sort of create barriers or walls and differences. So maybe it was a misuse of the word, but it's something we can talk about. Councillor Woods,
I'm sorry if I'm using the wrong words. Shall I leave?
No, Councillor Woods, you don't. I think perhaps saying overseas, people perhaps from overseas would be a perhaps more pertinent way of explaining what we're on about. But it's fine. No, we're leaving it there. We're leaving it there. We're leaving it there.
Did I not use international?
No, it's okay. Right, can I go now, please, to Councillor Osborne?
Thank you, Chairman. I've just got a couple of questions, because the issues of overdue assessments have been comprehensively covered, and I did get a very full explanation from Councillor Wakefield on some other matters. Just going to page 45, I think it is, and it's the table of the quality, get this right in a minute, the practice quality audits. And I noticed that we're amber on 3 of them. One of them could be quite important, actually, bearing in mind we're talking about budgets and all the rest, and controlling cost, is people have been informed of the personal budget agreed for them. We're only 77% on that. So what steps are we taking to put that right? Because it seems as though communication between all parties might be an issue there. In terms of what's agreed and the understanding of what people have got to contribute. The other one, I think, again, that's a communication issue, which I'm sure you'll resolve. But the other one I think that could be of concern is mental capacity assessments, following the 5 principles and obviously being evidenced in people's records. And we're not quite there on that one, we're 85%. What steps are we taking to improve ourselves on that? Because actually that is quite important in determining whether somebody actually has the capacity, because that can influence the outcomes for that individual patient quite a lot.
I should have said when I presented these, so that the findings of these practice quality audits are reported to our practice quality board as well. So they would have analysed these results. I think in those 3 scenarios where they're amber, the predominant factor is that there wasn't clear evidence that that thing had happened. It's not necessarily that it hadn't, it just wasn't clearly evidenced that it had. So I think there's a theme around case recording, and actually it's what we call our carnival of practice this week. So a kind of learning and development opportunity. One of those sessions has been on case recording. So I think it's being picked up through that sort of route.
So next time, hopefully those should be addressed and we should be looking at a full green slate here, that we are getting things right.
You're never going to have a green slate, are you? Let's be realistic.
No, I know.
Otherwise we wouldn't be doing this, would we?
It's some ambitious.
And one of the challenges for us always be, and I'm sure you'll hear it later on in our safeguarding report, is around mental capacity assessments and getting that right. So I'm really pleased that we're at 85.70% that we can see. If you'd looked at that 2-3 years ago, it wouldn't be there. So people are starting, it's better, it's not good enough because it needs to be 100% where it needs to be, but we're getting better at that. And as you described, as part of our carnival of practice, so that's a week support that we put into teams, and we've got lots of outside individuals coming in, sorting, talking, it's great. And that's all been about communication this year. So what we've done this year is have that around communication. How do you communicate properly? As part of that, mental capacity has been picked up. As part of that, other areas have been picked up. But anything that is amber, we have a plan of how we do it. How do we work with staff, whether that be lunch and learn sessions, whether that be different ways of talking to our staff to help them to continue to improve. We're never going to get it all green. And I hope we wouldn't, because then we're not probably assessing in the appropriate way. So, you know.
Okay, and I just had, Madam Chairman, I just had one more question. Relating to handbags, and I think last year's figures at 13, my understanding is those were slightly distorted because we had one provider hand back a significant number of packages because they were restructuring their business operation. We're now at 9 per month. But in terms of the preventative agenda, what are the main reasons that people are handing packages back? And what can we do possibly to prevent those handbacks happening? Because it obviously costs us when we've got to go back into the market, and the odds are that those packages are going to be resourced and it's going to cost us more, not to mention the hassle and disruption to our clients.
John's looking into the report quickly. He'll dig down into it because we've got all the reasons. What I would say is, while he's finding the exacts, you're always going to get some handbacks because sometimes families choose not to have the provider, or providers choose not to go into that family, and we will always have some families that may present. And it's often the family rather than the individual that is presenting with those challenges for us. So we sometimes have to find different providers. But I'll let John think about it.
We capture the main reason for a handback, so we can include this in a report in future. But since we've been capturing handbacks, which is from April 2021, 50% of the handback reasons have been around staffing or capacity of the provider, and that would include, as you pointed out, if a provider ceases to trade and hands back all of their packages, that would be picked up as staffing capacity. And picking up Mel's point, the second highest reason is client behaviour or service users behaviour, which is 17% of handbacks. And that's where the provider just feels that they're no longer able to work with that person.
Thank you. Thank you. I think that's really interesting about handbags. I had no idea of the complexities of it. So that's been really very interesting. I've now said that I really do want to go just to Mandy Chilcott now, because I think we really have done this really, very well. So can I just go to the last speaker, Councillor Mandy Chilcott, please?
Thank you. Very, very quick question. So we've seen there's a slight increase in telephone calls in. My question is, at full council, the complaints across the council, I think, had trebled in the last year. So my question is, one, how has adults seen a big increase in complaints, and has that got a connection with the increase in phone calls in?
No, we haven't seen an increase in complaints in adults. It's stabilised where it often is. I don't think that is it. I think people know where to ring, so they ring. But actually what we've got to do is resolve that at that point. And that's about resolving that by using our communities, our voluntary sector. And that's what's working well. We also have encouraged people to ring for our silks, our Somerset Independent Pluses, so we can do our appointments there, which is another way of helping people stay as independent as possible. So they don't need to come to us to use those. They can be a self-funder that uses those, that actually can buy the equipment that they require themselves to keep us independent. So I think some of that may well, as we've reopened one in Yeovil, that's helped. And I know that some of that is because of that, which is good.
Thank
So it's
you.
good.
Yeah, victims of our own success then. Thank you.
Thank you very much, councillor. Thank you for that question. Now, councillor Lasham has snuck in there. Because she's the deputy leader, I cannot refuse her.
Thank you, Chair. I just wanted to make a comment that I've heard very recently about the complaints that were referenced at the full council meeting. I understand that the before figures that were quoted was Somerset County Council, including the Waste Partnership, but not including the districts. So I think what we need to ask for from senior officers is an update on the comparison of complaints. So I can't say any more because I don't know anymore, but I understand that we need an update on those complaint numbers. Thank you.
Very much, councillor Cation. We'll certainly look into that, and we'll see what can be done. Okay, thank you very much. I just want to say, members of this council, Councillor Stanton has asked me, but we're going to thank you, John, for excellent report. It's really in depth and like Mel's, it's a good report, and it's given us a lot more understanding of complexities of this. We had no idea. So I thank you for the detail very, very much, and the speed in which you presented. Thank you very much. We're now going to the next item 9, Safeguarding Adults Annual Report. This is a big report. A lot of work's gone into it. And as we all know, that safeguarding adults is always going to be on the agenda. And I believe I hand back to you, John. No, I lied, John.
No, you
lied.
You really don't. No. You hand straight over to Michael, who's
I
on.
beg your pardon. Michael, welcome. Thank you so much. Thank you. This is a 20-minute slot, Michael, but we understand you may want to be a little longer, but if we can try, that'd be great.
I won't be longer, Chair, and thank you for the invitation once again to Scrutiny. I'm very delighted to be here. Just a very quick summary of positives and some concerns arising out of the annual report, and then I'll be very happy to answer questions from members. Producing an annual report is a statutory duty on the Safeguarding Adult Board, and there are 136 Safeguarding Adult Boards in England, so each of them have this as a statutory duty. We also have a statutory duty to conduct safeguarding adult reviews, and the presentation and the report deal with where we are in Somerset in relation to the commissioning and the completion of reviews. We also have a statutory duty to produce and refresh a strategic plan, and the annual report comments on how we have refreshed the strategic plan in the year in question. The overarching mandate of the Safeguarding Adult Board is to seek assurance about the effectiveness of adult safeguarding across all of the services in Somerset that have roles and responsibilities to prevent abuse and neglect, and to safeguard adults who experience one or more of the different types of abuse or neglect. And you've talked a lot in the last 3/4 of an hour about complexity, and adult safeguarding is complex and it is multi-agency. I just wanted to emphasize the point about how complex it is for social workers, social care workers, district nurses, GPs, clinicians in hospitals, etc., how complex it is to address the multifaceted needs that are often presented through a lens of safeguarding. Positives are many, I have to say, in Somerset. Amongst those that I would want to highlight, which actually you've touched on in the last 3/4 of an hour, when I've had the privilege of listening to what you've been scrutinising. Preparation for CQC assurance. Mel and her colleagues in the local authority have engaged with the board and with partner agencies about the evidence across the 4 streams that CQC will seek assurance on, and in relation to safeguarding adults, the safety stream. I have confidence in the preparation that Mel and her colleagues have undertaken. The self-assessment is continually being refreshed and will no doubt be re-refreshed when Mel gets the phone call, giving her a number of weeks to conduct final preparation. And those of us who are independent chairs are sharing information about how local authorities have been scrutinised by CQC and the kinds of questions that independent chairs have been asked where CQC have visited. I also want to highlight the audits that Mel and John have talked about. I think that is an enormously positive development in Somerset. The board has received reports on those audits, and particularly on a mental capacity audit that Chris Hamilton and colleagues conducted to really do a deep dive into how compliant we are with the 5 principles and everything that surrounds mental capacity assessments, including deprivation of liberty safeguards. So I wanted to positively connote the use of audits. I also wanted to positively connote performance reporting. You've commented on the excellent reports from Mel and from John. I want to comment on the excellent reports that the Safeguarding Adult Board has received on performance reporting and quality assurance, prepared over the last year or so by Nikki Shaw, who's now left Somerset, and Vicky Chipchase will continue the tradition, I have no doubt. The performance reporting on adult safeguarding in Somerset is the best that I have ever encountered in all of my years of being an independent chair in London and elsewhere in England. It really is exemplary and gives us an excellent line of sight about how well services are collaborating in order to prevent and to keep adults safe from abuse and neglect. And finally, on the positive line, I want to commend the engagement by cabinet members, at the moment by Sarah Wakefield, previously by Heather. The representation that is given by cabinet members to adult safeguarding has been excellent. It's been robust, it's been challenging, it's been inquisitive and inquisitorial, and that's what I would expect from cabinet members who are given that responsibility. And alongside that, there has been excellent engagement by Mel and her colleagues, but also by Sheila and colleagues from the ICB, and by Lisa and colleagues from Avon and Somerset Police, the 3 statutory partners that must come together to ensure that the Safeguarding Adult Board functions effectively. If you ask me about my worry list, many of my worry lists are not just specific to Somerset, because Somerset operates in a national context. That national context over the last decade or more has been characterised by financial austerity that has had a major impact on statutory and indeed on third sector services. So when I talk about my worry list, my worry list is not necessarily specific just to Somerset. But if you were to ask me about my worry list, recruitment and retention of staff, we are not training enough social workers in England. We are not training enough nurses and doctors, particularly GPs in England, as a result of changes in how the government supports professional education. So when you hear in Somerset about the challenges that Mel is having to address in relation to recruitment and retention, that is not just a Somerset issue, it is a national issue. Self-neglect is on my worry list, and again, not just because of the position in Somerset, the evidence we have in Somerset. We are at the moment conducting a thematic review of a number of cases where self-neglect was very evident, and I shall be able to report on the findings and the recommendations of that thematic review next time I appear in front of you. Also on my worry list is homelessness. Mel, as Director of Adult Social Care, the Director of Housing, and myself as an independent chair, received a joint ministerial letter shortly before the last general election advising about the governance of homelessness and rough sleeping, and the review of cases involving the death or near misses in relation to people experiencing homelessness and rough sleeping. This again is a national issue. It's not just a Somerset issue. I've talked to Mel about how we are going to address the recommendations in the joint ministerial letter, and we are already doing that. And I have established strong links with the Homelessness Reduction Board in Somerset, which is very positive. And we are developing a process of homelessness fatality reviews alongside safeguarding adult reviews to ensure that we learn lessons and improve services in relation to those people experiencing homelessness in Somerset. You've heard about the reviews of placements. That too is a national issue and is on my worry list nationally as well as locally. We know particularly about the challenges for local authorities like Somerset and ICBs like Somerset, who are net importers of placements made by commissioners from other ICBs and other local authorities. And what I know from my national work is that commissioners very often are not compliant with the statutory guidance about reviews of out-of-authority placements. So it's not just a case of whether Somerset are reviewing placements for which they are responsible. There is also a challenge in Somerset and elsewhere about how commissioners from elsewhere are reviewing the appropriateness of placements within Somerset. And lastly, specifically on my worry list in relation to Somerset, is having said how excellent performance reporting is on adult safeguarding in Somerset, we have more to do, particularly with Avon and Somerset Police, in getting data from the police about their involvement in different types of abuse and neglect. And I am in close discussion with Lisa Simpson and Tom Herbert in Avon and Somerset Police to ensure that future performance reporting includes police data on such things as hate crime and domestic abuse, to name just two types of abuse or neglect. So I hope that gives you an oversight in addition to what's in the annual report. I hope I haven't exceeded my time, Chair, and I'd be more than happy to answer questions from any of the elected members in the room.
Thank you. Can I thank you, Michael, very much. You'd never exceed your time with me. It was always very, very interesting, and I really appreciate the words you've said. And obviously, I think you talked about homelessness. I think this is something that we can bring back and put on our future casework to look at homelessness on to Somerset Scrutiny. This committee is really very thorough. They're very, very good, and we are very lucky to have our portfolio holder, who is also on the Somerset Safer Partnership Board, which does make the difference because she's obviously will keep us informed. So we thank you for your time, really do, for today. And it is a very, very good report, I have to say, once again. Councillor Wakefield, do you wish to, as you are on the board, do you wish to say something first before I go to members?
No, just to say how lucky we are to have Michael as chair and drawing it all together. And it really does help the meetings. It's helped me. He's had a private session with me to try and get me up to speed. I hope I'm learning quickly. I would like to just mention, talking about homelessness and rough sleeping, there is an initiative, and I think it's the NHS, I don't think it's us, to outreach GPs and nursing to rough sleepers, and it is actually paying off because people are saying, if they're going to be visited actually where they are rough sleeping, getting some help and care, it helps to bring that trust back into the system, because people who are living in that way have lost trust that anybody is going to help them or stay with them, and that apparently is being really fruitful. They talked about it at the Health Wellbeing conference that I went to recently, and it was really interesting. And just to say that there is something, it's not enough. And now my portfolio covers housing and homelessness, and Mel and I together will be looking at that. But that's something. I think there are little things happening, or perhaps big things, which may make a difference.
Thank you. Can I also say, Michael, that the shared data is something we've been bleating on about from this committee for a long, long time. And I think when you go to the hospital or you go to the police or something else and they don't know anything, they don't know any details, very frustrating. So we will carry on asking for shared data, how important that is. So thank you very much. Can I go to Councillor Woods, please?
Thank you. This is actually something I picked up from the report. The board attendance, you wanted other people to be involved, but the board attendance doesn't show that those people were involved. On page 55 of the report, that there was nobody from the voluntary sector represented, and I think that's quite important, because I think a lot of certainly the churches have safeguarding reps all over the country. So, they're not represented. Actually, the people that come now, is that because, and the ambulance service, I think, did I pick up the ambulance service? Not attended. Is that because they're not invited, or because they haven't turned up, or why don't they turn up to the board meetings? Is it the nature of the board meetings, but you have other ways of contacting them? That's really my question, because there's a lot of organisation out there that are worried about safeguarding, and they do have representatives, and I just wondered if we just don't contact them, or they don't turn up. I mean, who knows? I sometimes don't turn up if I'm lucky. All right.
Okay, I can, with Chair's permission, answer that very relevant question. In relation to the ambulance service, I and indeed other chairs in the Southwest region have had several conversations with the Ambulance Trust, which is actually commissioned by Dorset ICB on behalf of the Southwest. I think the ambulance service would be the first to recognise that they have not been where they need to be in relation to the engagement with safeguarding adult boards. There's been a management review of the Ambulance Trust, and additional resources have been injected into the Ambulance Trust, and we do now have a named representative from the Ambulance Trust who will link with the Safeguarding Adult Board. So I hope, on the basis of the work that the Ambulance Trust has done and the appointment of additional staff, that the representation of that trust on our Safeguarding Adult Board will show an improvement next time I produce an annual report. In relation to third sector organisations, and particularly faith communities, candidly, we have got much more to do here to engage with faith communities and other community groups, many of whom, as you have correctly pointed out, have safeguarding leads. And that is certainly on my agenda, to reach out to community organisations, including all faith organisations, in the course of this year.
Thank you very much, thank you. We now need to go to councillor Bruce.
Thank you. Thank you very much for the report, really comprehensive and very interesting. I've got 3 questions. Do you want me to ask them all in one go?
Yes.
Okay,
Yes,
all
and
right.
then I'll do my best to answer them.
Thank you very much. Following on from Councillor Woods, I was also quite surprised that some of the attendance figures were 0, and I think one of the most important for me was actually getting a representative of somebody who actually used the service into there. So I hope that's on your agenda as well. That's more of an observation than a question. The second thing was about the where physical abuse is happening, and it shows that the physical abuse is happening in, or abuse in some way is happening in homes, but there's also quite a lot happening in service providers, which I was quite shocked at the amount there. It shows the percentage, but I'd kind of been under the impression that it was like the odd case that was coming up in the media or something, but that's happening at service providers has been quite shocking for me. So if you could, really, I'm not really sure what my question is here on this. I was surprised by it. So a little bit more information would be really helpful. And then the other question is on the ethnicity of those people whose concerns have been raised about the fact that they are the majority white ethnicity. Does that mean, is that just in line with our population, or are we just not hearing about cases that happen in other communities? I'd just like your opinion on that, please. Thank you.
Okay. Service user involvement in the board and indeed in its subgroups is something that we had a presentation on at the first, I think it was the first safeguarding board meeting that I chaired, because it is a priority of mine to find the best way of involving people with lived experience of safeguarding as part of our efforts to seek assurance about the effectiveness of safeguarding in Somerset. We have had case presentations delivered by practitioners based on what people with lived experience have told services about what helps and what does not help. And that's useful, but it is not the same as hearing directly from people with lived experience. So again, quite candidly, we have more to do here to find the best way of enabling people to speak their lived experience to us. And that may be attendance at a full board meeting, or it may be attendance at conferences or webinars. That depends very much on what people themselves feel most comfortable to do, but it's certainly on the agenda. In relation to abuse by providers, we have had examples in Somerset historically, before my time, about abuse in residential and nursing care provision. Some of you may recall a SAR that was done, a review that was done in Somerset known as Mendip House. There is a review nearing completion at the moment where we are very concerned about neglect and acts of omission in a particular provider service working with people with learning disability and neurodiversities. This is, again, not just an issue that is specific to Somerset. We have developed a procedure, we signed it off at the last board, about how we will respond to abuse by people in positions of trust, particularly people employed by service providers. Some of the abuse is acts of omission. Some of the abuse is neglect and very poor care. Some of the abuse is more systemic and is organisational rather than just at the door of individual practitioners. We also have to be alert to abuse or neglect in a person's own home by care providers, and indeed there's been a national project led by the Department of Health and Social Care and the Home Office on safe care at home, So our oversight of how safe care is in a person's own home is also important. And lastly, on ethnicity, this too is a national issue. The vast majority of adult safeguarding nationally is a response to white British, white Irish individuals rather than people from other cultures, other traditions. And that is true, for example, in Somerset and in Lewisham, where I am chair and was chair, where there was a considerable underrepresentation of safeguarding in relation, for example, to Black British, Black Caribbean, Black African communities. And I think we continually have to ask ourselves how our services are perceived by people from different cultures, and whether we are culturally aware, culturally informed, and whether what we are offering is culturally appropriate. So you've identified three very important issues that we need to be alive to and responsive to in Somerset.
Thank you very much. That's very reassuring that they're high on your agenda. Thank you.
Thank you, Michael. I've taken over as chair. Councillor Slocum had a pre-arranged appointment and actually did put herself out to be here today to do both. Probably not to land me in it, but for my first stint as vice chair. But I was prepared to chair from the beginning. However, I just going to say those were really, really good questions. And Councillor Woods had the same question as me, and I think the two are kind of linked. And you are saying you're prioritising community engagement and how you can listen to those with lived-in experiences. It's such a strong report, a difficult report, but actually a brilliantly laid out report. Actually, I enjoyed reading it, which is the wrong word, because it was actually shocking, really, some of the findings. And as you say, it's everybody's business, safeguarding everybody's business. So we're overrunning, and another member had to leave because 12 o'clock was their cut-off point. So we've got a couple more questions. And I'd say if you have multiple questions, perhaps you can prioritise those questions. But I'm sure Michael and the rest of us would like to know what they are, and so perhaps there could be an email exchange. So if you do have multiple questions, if you could just prioritise, please, because we've gone past our time. Although this is a very important subject, so it's over to you. Thanks.
Thank you, Madam Chair. Yes, I'm afraid, like some others, some of those figures are shocking, particularly that 30%, over 30% of abuse, the location is actually residential in nursing homes, where you would expect people to be safe, and clearly they're not. Also, that service providers, when you look at the graph below, service providers, and that covers, as you say, a multiple, and it would be useful to know when we're talking service providers, are we talking carers at home, are not as differentiated from nursing, residential, and other. And also organisational abuse. I'm not quite sure what organisational abuse is, but Michael will probably be able to enlighten us. But how do we communicate back to the Care Quality Commission? Because it links into Councillor Bruce's earlier point about how often homes are being assessed. And how do we link this information back to CQC to say that prompt action is taken where this is found? Because certainly people, certainly as a contractor, adult service care, what concerns me, could be going or accepting contracts from homes with perfectly good CQC, but this is going on. So there really needs to be a way of communicating that information and making sure the inspections are done properly, because the thought that you could be sending or using taxpayer money to possibly be supporting people in these types of placements, I find that disturbing, and maybe we need to be having a much closer look at this and what we can do to ensure that we do not wind up in the headlines because we've actually sent someone into a care home that might be failing, even though the figures are telling us actually they're not.
Okay, thank you. Again, this is in part a national issue. It's not just a Somerset issue. What is organisational abuse? Organisational abuse is where the culture within a service is closed, is not conducive to excellent care, excellent person-centred care. In other words, where staff are working in a climate that is not conducive to best practice, but in fact is conducive to abusive or neglectful practice. In other words, it's distinguishing from neglect or an act of omission, which is simply because of the poor care given by an individual member of staff, perhaps because they have not been appropriately trained or not appropriately supervised, or both. There is a definition of organisational abuse. It's in the Care and Support Statutory Guidance on the Department of Health and Social Care website, which perhaps might further explain what I mean by organisational abuse. Abuse and neglect in residential and care homes is sadly something that Safeguarding Adult Reviews have identified nationally. I was the lead investigator in the second national analysis of Safeguarding Adult Reviews, commissioned by the Department of Health and Social Care, the report for which is on the Local Government Association website. And the percentage of abuse or neglect in Somerset is very similar to what we know nationally. So Somerset is not an outlier when it comes to the types of abuse and neglect that the annual report is reporting. There is a lot of concern nationally that CQC has not been resourced to undertake reviews of providers nearly frequently enough. What we know from Safeguarding Adult Reviews and from our work with commissioners and in particular is that vigilance needs to be 24/7 and not just periodic. If we are really serious about counteracting abuse in residential settings and in nursing homes, we need much stronger vigilance. The CQC is a very important component in that. Contract managers are a very important component in that. Where placements are being commissioned by commissioners outside of outside of Somerset, they need to be following the statutory guidance about their roles and their responsibilities. And Healthwatch needs to be exercising its enter and view powers and escalating concerns to our adult safeguarding colleagues and our provider concerns colleagues. So if you were asking me, are CQC assurance visits to providers frequent enough? The answer is no. Are you asking me whether those periodic inspections are as robust and as thorough as I think they ought to be? Sadly, sometimes not. So yes, the picture is really quite concerning, but it's a national issue. Having said that, the CQC has recently become, in my view, much more transparent and open to concerns and perspectives being offered by directors of adult social services like Mel and independent chairs like myself, and now does have a specialist unit focused on organisational abuse, which is a very positive development.
Thank you, Michael. Can we go to Christine, please? Sorry, I just had one more. Is that?
Yes, I'll be very quick. I just wanted to thank Michael for all his work and support, and underline the situations which has been worse than I can ever remember in my head, the sleeping rough and women as well as men sleeping out all weathers and senior ages. It's been a really eye-opener this year that the situation for older people in their 70s is clearly a lot worse than I'd ever imagined. So thank you for what you did to highlight the situation, and hopefully we'll be able to make some progress in this very difficult area.
Thank you for that. Can we go to Mandy, please? Mandy, is it okay to prioritise questions if you have multiple questions? Thank
I
you.
haven't got multiples. First is to say thank you for your work, and I echo Christine's comments. And I suppose my concern looking in that quite often individuals might fall through the net in that they might be with the homelessness team and then might have a mental health issue, and then they've got health issues if they're homeless, that then, you know, you can't take tablets perhaps easily. So for me, there's often a complexity around it. And my concern has always been that people fall between agencies and people. And I still see an element of that. So that's a concern for me. And just to pick up quickly on your comment around GPs and lack of them, you know, I know that this year a lot of GPs applied for training positions and they were not the training positions to move into. So there's a wanton desire for people to do it. There aren't the spaces. And also, if there's anything you can do, a lot of this is around funding and how surgeries are able to spend their funding. A lot of it is not on GPs. So, you know, anything you can do to unlock and have those conversations, I think would certainly help Somerset and certainly Minehead, because we would welcome some here. But thanks for the work you're doing. And if you've got the ear of people, I'm absolutely supportive and behind you. Thank you.
Thank you, Councillor. I do have a national role. I am currently the convener of the National Network for Safeguarding Adult Board Chairs, so I have routine meetings with civil servants in the Department of Health and Social Care. We sent a briefing for the new government about what we believe to be the priorities for improvement, including in the legal rules and the funding arrangements underpinning adult safeguarding. Mel and colleagues in ADAS, the Association of Directors of Adult Social Services, have a copy of that briefing, and I await a detailed response from the new government about how they will respond to what we have identified as service improvement priorities, which are evidence-based. They're from safeguarding adult reviews, and they're from our listening to people with lived experience, but actually also to frontline practitioners, which you and a number of your colleagues were emphasising earlier in response to earlier items on the agenda. In relation to people falling through the net, I think a positive development here, if I may venture an opinion, is that housing will now be part of Mel's portfolio, that you are bringing together adult social care and housing, brackets, homelessness and rough sleeping, into one portfolio. I think that's a very positive development. But we still have a fracture between social services on the one hand and our health colleagues on the other, at a point where we need a whole system, whole person response. And part of my preoccupation will be about do I have assurance that when you have somebody with physical disabilities, neurodiversity, mental health issues, substance misuse issues, accommodation issues, can we demonstrate a whole system, whole person response? Because that's what we need. And I heard one of your colleagues earlier talking about in-reach and outreach. What we know from research is co-location works. What we know is that if you place social workers alongside GPs, if you place housing officers in hospital discharge teams, if you place mental health professionals alongside our police colleagues, particularly out of hours, that kind of co-location is much more effective than each service occupying its own building and working within its own silo. So I shall be pushing for assurance that we have a whole system, whole person response. I've no doubt that Mel will be pushing for that too.
Thank you. I think we're all behind the work that you do, and thank you for it.
Thank you, Councillor. So I think the two things that I could draw out from that discussion is to encourage you, which you've identified yourself in the report about listening to lived in experience, those views, and you've identified as a priority community engagement. And I mean, seeing that in the board attendance is only it's a tangible way of seeing it, but that I guess that's what the thread I've got from our discussion. And the other sort of priority for us seems to be how we can strengthen our working with you. Because the fact that I couldn't take another question from some members was because we've run out of time. So maybe we need more time. Maybe if there are other opportunities to be working with you as a committee. In November, is there a Stop Adult Abuse campaign? There was in 23. Is there one in 24 that we can support your working? So thank you very much. It's an excellent report, but it's troubling and it's grim. But it's something we can build on and work with you as a key partner. So thank you ever so much for joining us today.
You're very welcome, and thank you for your time and your questions.
Thanks. We've got agenda item 10 left, and forthcoming key decisions in adult services. It's in our pack. Has anybody got any questions on that? And I don't know if we usually ask Councillor Wakefield to give us anything she wants to pull out of that, bearing in mind we've got little time. But if you do have anything you want to sort of highlight to us, Councillor Wakefield, and any questions from any members in the room or online agenda. This is page 141 of our report pack.
The Somerset Homelessness and Rush Sleeper Strategy has been worked on for some time. I've had a presentation about that, or there has been actually a presentation. I think it might have been to the whole council. I don't know. That's coming forward. That's being looked at and will be brought before that meeting in January, which I'm very pleased about. By then, hopefully, we'll have a bit more idea of the shape of the team and how it's going to function in this change that we're having. And one other item. The specialist, I think it's dementia beds, block beds, is not coming. It's coming to our next executive. It was going to. It's got slightly out of kilter, so I don't know whether it's got time to get coming in December, isn't it? So has it got time to come to one of these meetings before? No, don't think it has.
It should be circulated, and the chair will have to comment.
Yeah. Okay. Well, that's what will happen about that. Other than that, I think I've got anything particular to say. The advocacy service, I think, is that Swan, isn't it?
Right, one.
It was Swan. I mean, just for people who don't know, this is for people who can't advocate for themselves or have got a family member. We will sometimes put somebody in place externally to speak for them and on their behalf. It's very important, actually, because that person can then get their confidence. And there may be a situation within the family that they can't have that confidence without having somebody external. I had a presentation from them. I thought it was very interesting. So, thank you.
Okay, thank you very much. Any questions from members in the committee? Thank you, Sue.
Sorry, Claire. I noticed that some items on the forthcoming key decisions, it looks like some are going to come to scrutiny, and two of them, like advocacy and specialist floating support service, but those aren't. So how are you deciding which ones come to scrutiny and which ones don't?
I'm not quite sure yet. I think we're going to have to come back to you on that one, is the answer to you. But thank you for the question, and we'll come back with it absolutely clear about when it comes and when it doesn't. We'll do that.
My understanding is that we have pre-scrutiny meetings, don't we, that are informed by the work plan and your feedback. So come back to you on that. Councillor Bruce.
Very quickly, going back to the work programme,
the CQC we've talked about a few times today. I had been told it was kind of covered in the reports, but I don't think it is covered enough. And I think we do need to look into more sort of key questions on that topic and include that in the agenda a bit more robustly.
So do you mean what the CQC does? Because I mean, it looks at all the care homes on a regular basis, and it's going to come to us for the first time because it's a new thing.
I'm talking about the risks involved for Somerset with the CQC and how their current situation in terms of how they're assessing our providers, how often, how well, and whether that causes us any risks.
We can follow that up outside here probably and bring you a quick briefing on that so that you've got that in between. Because we know when they're coming, when they're not coming, we'll give you that data. Whether we have a huge influence on that is a debate, but we can share that with you. But we can also probably share, which is as important, is what we do and what our statutory duty is as a local authority for supporting the quality of care in our care homes. We can do that bit. So if we give you the whole, we can do a quick briefing. Yeah, as a briefing, we can do a briefing, and then if you want something more, we can do that.
Great.
Thank you. Are there any other comments on the forthcoming key decisions? No. Well, just to let you know that, so the next meeting will be on Thursday, the 21st of November here. And just to thank everybody for your participation and for some really interesting questions, fueling some interesting discussions. Thank you very much. I close the meeting.
Thank you.